Hi everybody. Happy Saturday to you all. This is just going to be a quick little thing. Got to talk to you about my disability pamphlet. I did mine. I picked something I didn't know what it was, which is childhood degenerative disease, also known as Heller syndrome. Basically, it's a disorder that develops somewhere between 2 and 3 is when it usually starts, and usually if it's going to hit, it's going to hit before the age of 10. And what happens is usually the child's normally developing across all the areas, and then regression starts. And regression can be rapid or it can be slow, but it's across most areas: expressive language, receptive language, social and self-help skills, playing with peers, motor skills, and even if they've already established bladder and bowel control, that can go. Unfortunately, at this point, they have no idea what's causing it. There's some ideas about genetics. There's some markers they've found. They normally do, as part of the diagnosis, an EEG to actually see if the child has any brain activities that are abnormal, because about half the kids do. They also check for seizure disorders, because about half the kids develop those also. But it's a huge loss of skills, and unfortunately they have not found successful medication or any treatment for it. So it's rather a bleak diagnosis, because it's trapped. It's like your child, everything I'm reading is telling me it's like your child is trapped in their body, and it's there, but they can't access it anymore. Under the new DSM-5, it has been rolled and snowballed in with the autism spectrum. In a lot of ways it can look like that, except for the fact that everything is a rapid loss of otherwise normal development. The assessment, like I said, the assessment's an electrocardiogram. They'll do some blood work. They've done genetic work. There's a huge study at Yale. They're trying to figure it out. And really nothing is coming forth. They do use some medications for some of the things that develop. Like they'll use anti-seizure medication because some of the kids develop seizures. They will use some medication, maybe some antipsychotic to help with aggressive or repetitive behaviors that develop, but there's nothing to take it to make it better. Some of the other stuff that happens, a lot of the stuff, they haven't got a treatment. This is not this is what your kid has, this is what you need to do. It's very much a try, and what works for one kid may not work for the other. And it's also extremely rare. It's only 1 or 2 kids out of 100,000. So they really everywhere just sit there and say it's not autism, but we have to sort of treat it like it is autism, because so far that's all they've found that's close. They do behavior therapy, use an applied behavior analysis. They use some environmental therapy, very much sensory enrichment type stuff, getting the sensory experiences to help improve like they would with autism. Medications, like I talked about. Communication becomes a huge issue. These are kids that were completely verbal, talking complete sentences, reading, doing math, the whole 9 yards, and everything's gone. In some cases, they're using iPads to communicate 1 or 2 word sentences they could pull together, but everything otherwise is gone. So there's been questions on whether or not facilitated communication would be good, or if they could do it on their own. I mean, it's all very much an uncharted topic. Organizations, even when I started, there's the birth defect research for children. They have some information on their website, but the other thing they tell you is if you actually register as a parent of a child with a birth defect, they will put you in touch with other parents that have the same medical diagnosis. So that would be one way, because this is so rare, for parents to reach out. It's also, you can do the same with the National Association of Rare Disorders. Autism Speaks has a lot of stuff on their website about it, the Autism Society of America. And if you're more local, and even especially if you're looking for some different languages other than English, something more culturally diverse, really, take advantage of the Pacer Center down in the Minneapolis area. Their website is in a couple of different languages. They are also one that's used to dealing with this and has different supports for family and for the children with it at different ages. So this is really a debilitating disorder that we don't know what's causing it. But I guess that's it. Talk to you guys later. Bye.